And here we are at EULAR 2025 Day 3, and I'm Dr. Valentina Puccino, Assistant Professor and Immunorheumatologist at University of Pisa in Italy, and I'm here with Dr. Margherita Giannini from the University of Strasbourg. I'm very happy that you joined me today for this interview. Your field of research is inflammatory myopathies, and I found really exciting your research. I have some questions for you. First question, if from your research have you identified new mechanisms that can identify new phenotypes of diseases?
Hi everyone, my name is Margherita Giannini, and thank you very much for inviting me to speak today about our research project on inflammatory myopathies. Yes, we know that recent advances in multiomics technologies have revealed that inflammatory myopathies, also known as myositis, are heterogeneous diseases. We know that most patients have known autoantibodies targeting intracellular autoantigen, and these autoantibodies are associated with specific clinical phenotypes. For some autoantibodies, there is also a correlation between the titer of antibodies and disease activity. So traditionally, we believe that since autoantigen targeted from autoantibodies are intracellular, autoantibodies couldn't interact with them and exert any functional effect. However, recent findings show that autoantibodies from patients with inflammatory myopathies can be internalized into muscle fibers in the same subcellular compartment of the autoantigen and disrupt the biological function of autoantigen, and these indicate that autoantibodies may actively drive the pathogenesis of this autoimmune disease and justified the specific clinical phenotypes of different serological myositis subset.
Thank you very much. So the second question is, since my research is really related to metabolism, how metabolism regulates cell function in autoimmune diseases, I actually found really interesting that you found metabolism also implicated in myopathies, especially lipid metabolism. Can you please explain more in depth what is your research finding?
Okay, so anti-HMGCR autoantibodies are a biomarker of necrotizing myopathy. We know that these autoantibodies target hydroxymethyl glutaryl-CoA reductase, that is a key enzyme in the cholesterol synthesis and a pharmacological target of statins. Recently, we have shown that anti-HMGCR autoantibodies enter in muscle fibers, inhibit the function, the enzymatic activity of HMGCR, and induce the accumulation of lipid droplets into myofibers and myofiber necrosis. These indicate that both the accumulation of upstream metabolites and the depletion of downstream metabolites could participate to the pathogenesis of anti-HMGCR necrotizing myopathy. In parallel, another group published that in patients with inclusion body myositis, there are some metabolic dysfunction involving central carbon metabolism. Particularly, they found a decrease in glucose and acylcarnitine metabolism and an increase in lipid oxidation metabolism. Together, these two independent studies highlight that metabolic dysfunction could be a key pathogenic role in different myositis subtypes.
Thank you very much. And now moving to the last question. So do you feel optimistic about this new biomarker that actually includes also metabolism-related biomarker as also new treatments for the disease?
Yes, for biomarkers, we know that the accumulation of lipid droplets in muscle fibers and the decrease in HMGCR enzymatic activity in skeletal muscle are emerging as a potential diagnostic and prognostic biomarker in patients with anti-HMGCR necrotizing myopathy. What about the treatment? Of course, therapeutic strategies depleting the accumulation of upstream metabolites and supplementing the downstream metabolites could be a disease-specific therapeutic strategy for patients with anti-HNGCR necrotizing myopathy. Of course, other therapeutic strategies targeting the autoantibodies, inhibiting the production or neutralizing the autoantibodies could be effective for patients with necrotizing anti-HMGCR necrotizing myopathy, but also for other myositis subtypes where the autoantibodies are pathogenic. Finally, the mechanism of internalization of autoantibodies is still unknown and is the object of ongoing research project. Understanding the mechanism of autoantibodies internalization could be a very promising therapeutic strategy to inhibit the internalization and the pathogenic role of autoantibodies.
Thank you very much.
You're
Very
welcome.
interesting. Thank you very much, everyone, for listening, and enjoy the rest of the Congress.